Good day, everyone. We had some outstanding discussions today related to 3 cases of bronchial asthma. The first case was an adolescent, and we know that age group is a challenging age group to deal with. Using inhaled steroids, not fully controlled, using salbutamol, at least 6 to 8 doses in a week, despite taking the inhaled steroid regularly. And so this boy needed guidance. The mother significantly concerned as to what needed to be done next. And the safety of inhaled steroids being used regularly in children of that age, both with respect to habituation and with respect to side effects that inhaled steroids have been reported to have. The importance of using peak flow meters was also addressed. And I think we discussed very relevantly how to move from regular inhaled steroid to adding on a LABA and how that transition should occur, and the issues that general practitioners face when such transitions happen. From this case, we move to another very interesting gentleman, Mr. Pill, who was using regular oral medication to control his asthma and brought over to the clinic by his girlfriend, asking what could be done better and whether what he was doing was appropriate. And of course, we know that oral medication, despite all the guidelines, still is used by many primary care physicians across the world, yet should be restricted to negligible, maybe the occasional leukotriene modifier, oral prednisolone for an acute severe attack, but certainly not oral beta agonists and oral theophylline, which have almost no role in current asthma guidelines. And so that case illustrated it, and it was followed by an elegant talk by Christopher Wasnop on why inhaled medication is so important for our patients with asthma and so relevant in a primary care practice where oral medication should be the least preferred medication. And we ended with the final case on a 36-year-old lady who was worried about using inhaled steroids should she become pregnant. And a lot of that discussion focused around the issues with inhaled steroids in pregnancy, their safety. And Christine beautifully brought out the aspects of why inhaled steroids should be used, the issues concerning spirometry in pregnancy, and how to address the patient's concerns. This followed up with a short presentation, just a few minutes, from Christine on the new GINA guidance on asthma and how that is changing practice for primary care physicians. So all in all, in these 50 minutes, we've had some excellent case discussions and a final resounding message that close to 80% of asthma patients can be managed in primary care practices very easily. And I hope you go home with these messages and the issues that were addressed around the 3 cases presented. Thank you very much.